is cut with the scissors in order that its orientation may be retained during the entire operations of punching the holes and making the placement on the Visidont. Now looking at the rubber dam template for use with the Enadon frame and the Visidont, we note that there are series of dots on the template, and the rubber dam is placed over those dots and within the outline of this 6-inch by 6-inch piece of rubber dam. And using the series marked for numbers 18 through 25, we'll mark these, each of these locations. (18, 19, 20, 21, 22, 23, 24, and 25. Now the rubber dam punch is taken. The punch has a table with openings in it and is positioned for the molar tooth first, and placed over the rubber dam and brought to the position of the marking for the number 18 and depressed until the opening is punched, and then the other molar, number 19. Then the table is rotated to a smaller opening as is designated by the illustration on the template, so that it can be used with the bicuspid. That's the second bicuspid, number 20, the first bicuspid, and the cuspid. A smaller opening now will be used for the lower incisors. The left lateral, left central, and right central incisor. Now the rubber dam has been punched and is ready for placement. Now bringing back the rubber dam clamp, first the clamp will be placed and then the rubber dam will be placed. The clamp again is placed so that the jaw will engage the molar tooth first on the lingual aspect. Notice that it's being dropped toward the lingual, tipped upward on the buccal, because it's possible to look carefully only at one or other of the surfaces. So it will be placed first to the lingual and then tipped over toward the buccal. When the clamp is in position, the forceps is slowly released until the clamp engages the tooth firmly with the 4-point contact provided by the curvature of the jaws, and then the forceps will be removed. Now looking closely again at the 4-point contact as the clamp engages the tooth, noting that there is no contact of the clamp with the tooth in the area of the center of the jaw, but that each of the points, 2 on the lingual and 2 on the buccal, engage the tooth so that the clamp has stability and will remain in place throughout the isolation of this case. Taking the rubber dam material and turning it to the reverse side, which will go against the tissue around the teeth, and using the water-soluble lubricant, a small amount is placed on the rubber dam and then spread very lightly to assist in carrying the rubber dam through the interproximal contact areas. Now returning again, and here's the time when this orientation of the cut corner of the dam becomes very important. Orienting it in the upper right and stretching the last molar opening of the dam in an oblong position so that it can be carried over the bow of the clamp. Coming over the clamp, sometimes this pressure is going to perhaps disarticulate the lower member of this viscidont. And then coming on forward to the lower right central incisor and carrying the dam through that area. Now, it may be necessary at this point then to take the ligature and place it on the tooth and carry the rubber dam material through the contact area. At this stage, it's placed through with a double strand of the ligature and left in position so that the rubber dam can be maintained in that most anterior tooth. Now bringing the rubber dam up and taking the rubber dam frame. The frame will then be positioned, holding and placing the upper ends of the frame first, and drawing the rubber dam over the small pegs on the rubber dam frame. It's merely engaged. These do not penetrate the rubber dam, but merely engage the rubber dam with moderate tension. Then the lower portion of the rubber dam is brought around the frame for the beginning of the receptacle portion. And again, it's brought over the pegs with some tension, and the frame is beginning to be stabilized in position. Now, in order to go on with the completion of the frame placement, the corner is taken and doubled back under this lower right peg and stabilized or held under that peg and brought up over the peg on the front of the frame, right here. And we'll do that again on the opposite side. Place that one behind that lower left corner peg and bring it up over the front to engage this one, and we have established there then a receptacle which will contain fluid coolants when they're used with the rubber dam in position. Now then, the middle pegs are used to pick up some more of the slack in the rubber dam, and just with a small amount of tension they are held in position. Now it's possible to go back to the placement of the rubber dam and carry through these other contact areas. And by stretching the rubber dam, it will carry through the interproximal contact on many of the teeth. Some of them may require further assistance. it may be necessary or possible to spread the teeth slightly by inserting the thumbnail and getting the rubber dam to pass or start passing through. It's also possible and helpful to take another piece of ligature material, the floss ligature, and place it to carry the rubber dam through. It's always necessary to place the ligature material on the tooth and not on the rubber dam itself, but on the tooth and slide it toward the interproximal contact area and carry it so that it will carry the rubber dam through that contact area. And we'll carefully go around to each of these, carry the floss ligature through each of these contacts, making certain that the rubber dam has been carried through each one. Now it's possible to note here that the rubber dam, which was carried over the clamp, is not sealing around the molar tooth. The contact of the clamp against the tooth is fine, but the contact of the undersurface of the clamp against the gingival tissue is preventing the rubber dam material from engaging the tooth and producing a seal. When this occurs, we merely take the rubber dam clamp forceps again, insert them in the clamp, and very gently loosen the clamp just slightly so that the rubber dam material may slide underneath and around the tooth and complete that sealing operation. Finally, it's necessary then to do the eversion of the rubber dam. After the rubber dam has merely been placed, as is shown here, the rubber dam material is coming upwards on the surface of the tooth. It's now necessary, in order to produce a moisture seal, to use the spoon excavator and going carefully around the tooth to invert the rubber dam so that it is turned downward into the gingival sulcus. This is done with each tooth in order to provide assurance that moisture cannot pass through the rubber dam and seep in around the teeth. The same is accomplished on the lingual aspect of each tooth. Many times this eversion will take place when the floss ligature has been passed through the contact areas previously. Now finally, the rubber dam then is positioned right up over the upper teeth, noting that the frame is in a proper orientation to the arch. The curvature of the frame follows the curvature of the arch. The clamp is stable. The rubber dam is retained in the most anterior tooth, and the eversion around each tooth has been completed. The receptacle for containing the fluid coolant has been formed, adequately, and the placement of the rubber dam in this Visiodont has been completed and is ready for operating on any one of these teeth. The removal procedure is now rather simple but must be done carefully. First, the rubber dam is going to be disengaged from the frame, and the frame will be removed first. The rubber dam clamp forceps engage the clamp and remove the clamp. The ligature was taken out of the most anterior tooth, the area that was being retained there. Now, using the scissors and stretching the dam away from the teeth and placing the finger underneath the rubber dam, between the rubber dam and the gingival tissue, the scissors are placed to cut the interseptal rubber dam one at a time. The rubber dam is drawn away from the tooth. The tips of the scissors should be visible each time before making the cut to assure that that they are not injuring other tissue. Then the rubber dam may be removed, and immediately upon removal, the rubber dam will be inspected to be certain that all of the rubber dam material is there. Should there be any rubber dam missing, or any fragments of rubber dam missing, then it would be an indication that there may be a fragment lost in the interdental region, in the interproximal of the teeth, and this would cause injury to the tissues. And that's been inspected and is confirmed, then the removal procedure is completed. Now, a modification of the rubber dam placement necessary for the Class 5 restoration involves the punching of the aperture for the tooth to be isolated for the Class 5 restoration slightly out of line from the normal alignment from the template which was shown in the previous application. Noting here that, again, with the mandibular left quadrant to be isolated, and this being tooth 18, 19, 20, 21, tooth 21 with a Class 5 restoration to be treated, then will be punched slightly out of line to the buccal in order that the rubber dam is not stretching unusually far to be carried into that deep cervical aspect. Now, the placement of the rubber dam for the quadrant will be done as has been previously done, and then the additional rubber dam clamp will be used for improved retraction of the rubber dam and gingival tissue. This rubber dam clamp is a double bow clamp and again has the ligature attached. The clamp is engaged with the forceps and is placed over the tooth, again being assured that the lingual aspect is under control and positioned first, and the labial aspect is positioned, and the forceps released so that the clamp is released slowly, gently against the tooth. In order that considerable retraction of the tissue and rubber dam may be obtained in that cervical area, this clamp is positioned as shown, but then further means of stabilization must be used for this clamp. This is a softened clamp and does not have the temper in it to maintain its position, such as the previously used clamp. High fusing dental compound will be used and softened to stabilize this clamp in place. Now the compound is softened and is placed under the bow of the clamp and around the bow, and then will be molded with the fingers, which have been slightly lubricated with water or with Vaseline, in order that the compound may be molded into the embrasure areas, to the buccal and lingual aspects, and over the bow of the tooth of the clamp. Now the compound is again warmed with application to the other bow of the clamp. The teeth must be dry while this compound is applied, so that some adhesion is gained, and then the molding of the compound into the embrasure and over the bows of the clamp, as we see here. After the compound has been cooled by air syringe or water, the clamp is stable and united with the teeth, and the area to be treated is exposed very nicely, and the operation will continue.
The dental dam offers increased visibility and access in the oral cavity, controls moisture to ensure a dry, trouble-free working field, allows increased operating efficiency, is more comfortable for the patient, and helps protect the patient and the dentist from the transmission of infection or disease. With the dam in place, the patient's gingiva is protected from any bleaching or acid etching agents you may wish to use. The teeth can be kept completely free of saliva or the contamination of hemorrhaging, and there is no danger of dental materials being swallowed by the patient. If the assistant has applied the dam as an expanded duty dental auxiliary, the few minutes it takes can be easily recovered in operating efficiency. Average appointment time can be shortened by as much as 10 minutes, and the doctor is free to concentrate on dentistry. This videotape will show you the preparation of materials and application techniques using winged and wingless clamps. Also, you will see how to use wedgets, a simplified alternative to clamps. It will also review some additional applications and highlight some tips which will make your adaptation of the technique easier and more practical. Dental dam material is available in a variety of colors, cuts, and thicknesses. You must select the type of material best suited for the dental procedure at hand. Hygienic dental dam colors include green, blue, dark, light, and Fiesta. Fiesta dams are boxed in an assortment of pink, blue and lavender pastel colors. The dark, light, and blue dams have a vanilla scent. The green dam has a light wintergreen scent. And the Fiesta dams have a pleasant, fruity scent. The material is available in either 5 or 6-inch squares or rolls. The smaller 5-inch size is convenient for petodontics, endodontics, or anterior restorations. Dental Dam also comes in a variety of thicknesses. The thinner ones are easier to apply, and the thin and medium gauges are most often used for endodontic procedures. The heavier dams are less likely to tear during operative procedures, offer better tissue retraction, and provide the maximum seal against moisture leakage. For this reason, the heavy and extra heavy gauges are used for restorative and crown and bridge procedures. Hygienics Dental Dam is a natural latex rubber and should be stored in a refrigerator or freezer. The material is guaranteed for 2 years following the date of manufacture, which is stamped on the bottom of each box. Before preparing the dam and the patient, you must determine which teeth and how many will be exposed through the dam. First, check the treatment plan for the teeth to be treated and the procedure to be performed. In determining the operating field, there is a degree of individual preference, but 3 basic rules most often apply. If restoring a posterior tooth, isolate 2 teeth posterior to the one being treated, if possible, and extend to the opposite central incisor. To restore anterior teeth, isolate all of the anterior incisors, premolar to premolar. For endodontic procedures, isolate only the tooth which is receiving the root canal therapy. Next, before proceeding, check the contact areas of the teeth in the operating field for roughness by flossing the teeth involved. If the floss frays, use a finishing strip to smooth the rough area. By doing this, you will avoid ripping the dental dam during placement. Since the dental dam apparatus may be unfamiliar to your patients, take the time to explain things to them. This is especially important when dealing with children. You will find that patients are more comfortable and secure with the dam in place. And patient management will be easier, especially in pedodontics. You can show the patient's Hygienics Dental Dam booklet if you wish, as part of your instructions. Let them know, for example, that it is safe to swallow with the dam in place and to relax and breathe through the nose. Finally, to ensure comfort, lubricate their lips to prevent irritation from dryness. Preparing the dental dam material involves marking, punching, and lubricating it. Check the treatment plan again to verify the operating field. In order for the dam to fit properly, there must be holes punched in the material to correspond to actual tooth positions. A template or stamp is available as a guide to normal tooth spacing. Be sure, however, to check each individual for spacing variations or missing teeth. The dental dam punch is a special instrument designed to cut a hole which precisely corresponds to tooth size. Make sure to use a sharp punch to make the holes, as a ragged opening could cause the dam to rip as it is stretched over the tooth. Holes must also be of the correct size. The largest hole the punch can make is for a clamped molar. In descending sizes are holes for molars, premolars and canines, maxillary incisors, and mandibular incisors. Remember, if you use the largest hole for all teeth, it will not make dam application easier. Rather, it will cause problems with unnecessary leakage. Proper hole punching is easy. Simply position the point over your mark, then compress the punch and pull the dam up over the point to ensure a clean cut. After all the holes are punched, you should lubricate the dental dam. A water-soluble lubricant spread directly over the holes on the tissue side of the dam will ease placement between the contact areas. Do not use Vaseline or cocoa butter, as these will adhere to the teeth and contaminate dental materials. The dental dam must be anchored to the teeth with specially designed clamps or retainers. The clamp is placed on the most distal tooth to be isolated with the bow placed distally. For the clamp to be stable, it need not cover the entire facial and lingual surface. It only needs 4 points of contact. It must, however, be placed below the height of the tooth's contour without impinging on the gingiva. There is a wide variety of dental dam clamps to cover any given tooth. However, you don't need to stock each and every type and build up a large inventory. Selection of clamps need not be difficult or confusing, as we will show you here. There are 2 basic types of clamps, winged and wingless. Wingless clamps are smooth at the jaws and are identified with the letter W on them. This type of clamp is put on the tooth first, and the dental dam is stretched around it. Winged clamps are so called because they have projections at the jaws. This clamp goes into the hole of the dam first, and then the assembly goes on the tooth. Choosing between winged or wingless clamps will depend on personal preference or type of procedure. Both types, however, come in a variety of shapes which must be suited to the tooth shape. The designation number of the clamp will tell you its intended application. Mandibular molar clamps, a number 7 for example, have long, flat jaws to conform to the length and shape of such teeth. Maxillary molar clamps curve on the inner edge to better fit the curvature of these molars. Premolar clamps have shorter jaw areas because of the shorter teeth. Double-bowed clamps are used to isolate single anterior teeth, such as in endodontic treatments. Any clamp with the letter A following its number designates that the jaws project downward. These clamps are most often used on partially erupted teeth or those difficult to grasp. The number 8A, for example, is an excellent pedo clamp, with the 14A being most suitable for partially erupted third molars. Hygienic offers a package of 7 clamps which will handle most cases. The System 7 clamp pack, available in either the winged or wingless style, is color-coded for quick clamp selection. For special applications, however, you may find other clamps necessary. For instance, smaller molars require the use of a number 3 clamp, which has jaws shorter than the number 7. Specialized dam applications, as is needed for crown and bridge procedures, require a tissue retractor clamp. Brinker tissue retractors are thin and contoured to allow seating to the bottom of the gingival sulcus. With the 6 retractors, you can get maximum retraction without lacerating soft tissues. First, you'll see the wingless clamp technique of dental dam application, and then we'll present the winged method. In either case, application should only take a few minutes once you master the simple sequence of steps. Then, with repeated use, you will find methods which work best for you. The instruments and materials needed for dam application should be prepared. You will need clamp forceps, a small selection of appropriate clamps, dental floss, wax dental tape, a double-ended plastic instrument, the prepared dental dam napkins, and frame. In this case, we are clamping the mandibular first molar with a W7 clamp since we will be treating the mandibular first premolar. As a safety precaution, attach a long length of dental floss to the clamp. Then insert the tips of the clamp forceps into the holes of the clamp. Spread it open just enough to establish a small amount of tension and set the handle lock. Now, apply the clamp by seating the lingual jaw of the clamp first. While maintaining contact, spread the clamp just enough to clear the height of tooth contour on the facial side and slide it into place just below the height of contour. The clamp should be making good contact at 4 points on the tooth. Check it by placing a finger on the bow and pressing and roll down the excess. Grasp it with your thumb and middle fingers, leaving the index finger free. Pulling the dam sideways, use your index fingers to stretch the most distal hole. Pass the stretched hole behind the bow and slip it under each jaw of the clamp. Try to do this smoothly without tugging. Release the dam when this is done. Isolate the most anterior tooth to be exposed, making sure all the other holes line up over the remaining teeth, and slip the dental dam over them. Do not bunch the dam and force it through the contact points. Rather, use your index fingers to hold the dam tight against the lingual surface of the tooth, and stretch the dam out to the facial side, letting it hang over the occlusal. Pull one edge through first, and continue to pull through the remainder. The key to simple dam placement is to work with the edge of the rubber and knife it between the teeth. If you have difficulty with some of the contacts, come back to them later. Do not attempt to force the dental dam through the contacts at this time. Now, apply the dental dam napkin to absorb moisture or saliva and help keep the patient comfortable. Simply feed the dam through the napkin's hole and smooth it out. Then, apply the frame. Hygienic dental dam frames are specifically designed to permit better retraction and stability. Hold the frame in place and stretch the dental dam over the points of the frame. Try to make the dam as smooth and wrinkle-free as possible, as this makes it easier to complete any difficult contact areas from before. This is done by working wax dental tape through the contact, taking an edge of the rubber with it. Leave the tape in place and make a loop to the lingual side, carrying another small amount of rubber through. Then, you can pull the tape out to the facial side. Repeat this procedure until the interceptor rubber is properly seated. The final step in dam application is called inversion. Inversion is the tucking under of the edges of the dam around the neck of each tooth. This provides a secure, leak-free seal against moisture. To invert, apply a steady stream of air down into the sulcus as you pull the dam facially. Once the tooth becomes dry, take a blunt instrument and tuck under the edge of the dam as you release it. The dental dam is now securely in place, ready for efficient dental operation. The difference in using the wing clamp from the wingless technique lies only in how the clamp and dam are initially seated around the anchor tooth. Take the suitable clamp, tie floss to the bow, and with the forceps, test the fit on the tooth. Here we are using a number 7 clamp for the mandibular first molar. If the clamp proved suitable, it is then inserted into the appropriate hole in the dam so that the rubber is kept open by the clamp wings. With the clamp forceps, the assembly is carried to the mouth. The clamp must be opened enough to permit a view of the target tooth and installed as before, below the height of the tooth contour. With the clamp firmly seated and the forceps removed, a finger or blunt instrument is used to flick the rubber off the wings and onto the tooth. Dam application is then as previously described. When isolating anterior teeth only, apply the dam to the central incisors first by locating the holes over these teeth and stretching the dam over them. Tip the stretched rubber so that an edge of material goes through the contact point without doubling over on itself. Apply the frame and stretch the dental dam over the engaging points on it. Following this, work the dental dam over the other 4 anterior teeth. Then place a premolar clamp, a number 2 or number 00, over the dam and the first premolar. Place a second clamp over the dam and to the opposite premolar. Finally, invert the dental dam to complete the application. Teeth which are to be endodontically treated require that a single tooth be exposed through the dam. An anterior double-bowed wing clamp, such as the number 9, is very effective for this purpose. For quick application,